When dealing with acute neck pain, one of the most important things is to not move into that pain. And so if you've woken up in the morning, for example, with a kind of crick in the neck, it can be quite a scary thing because you're likely very, very limited in your movement, and it can be pretty painful. One of the things to take note of is, are you getting any pain into your arms, or are you getting any kind of tingling or numbness? Because we want to immediately find out, is there any kind of nerve compression? If there is, then it just means that potentially the muscles in the neck have tightened up so much, and also down the side of the neck here, where the nerves run out of, that we may actually be irritating a nerve now. We then want to try and find out what's aggravating that pain. Is it to the extent that literally I cannot move in any direction, in which case muscle spasm is likely the cause of that pain? Or is it that it's only one particular direction? So for example, only when you look up does it aggravate the pain. It's more common in that case that the joints have become compressed. And if it's much more painful when you bend your neck down, then it can be an overstrain of one of the discs in the neck. Either way, all acute episodes of neck pain will pass. So really, this is about how do we manage those acute periods? Well, we want to try and move within pain-free as much as possible. So if I had hurt my neck and moving to here is painful, then I'm only going to move to there. And it sounds simple, but we never really want to push into that painful barrier and try and stretch it out, because your brain has decided that it needs that neck to be tight, and so it's locking up those muscles to try and protect you. So imagine that the nose is almost a pen, and you're going to do tiny little figures of 8. You can almost draw the alphabet, just really small little bits of motion that are pain-free, little and often, little and often. A heat pack can be helpful for 10 or 15 minutes, but no longer, and it can almost act like a bit of a block to the pain, because the messages that give us pain and also temperature travel along similar pathways. And so if we overload that pathway with temperature, that's why we feel great with hot or cold, but perhaps when we take it away, the pain comes back. But in the short term, really, it's just a time thing, because an inflammatory process needs to take place. And that's not a bad thing, because we need that inflammation for that neck to heal. So that's really important. So keep moving within a pain-free range, use some heat, find out which movements are painful, which may give you an element of the diagnosis. And then within the clinic, we really need to get the laser on that neck as soon as possible to try and speed up the healing process. When it comes to pillows and neck pain, the first thing that we'd say is don't go and spend a fortune on over-marketed things, because comfort is king. And really all we want to do is make sure that there's some degree of support during the night. So if you're laying on your side, for example, we don't want the head to be sinking into a soft pillow and ending up here perhaps for the whole night when it's acute. So we want to have something a little bit firmer, even just putting a small towel underneath that pillow to give it something to bed into, so that when you sleep, there's some supported, there's support to the neck at a right angle during the night. Of course, once you're over this bout of acute neck pain, then actually just comfort is king. It doesn't matter too much, but when the neck is so acutely sensitized, we want to give it a little bit of support. So firmness is usually better if tolerated, but you don't need to go and spend a fortune on anything crazy expensive. Then the next thing to discuss is the setup of the desk to try and stop aggravating this pain. And so the first thing is to make sure that the monitor is at eye level. Now, for most people who are working at home, we're now working on laptops, which tends to be a little bit of an issue. This goes hand in hand with posture, because we all think we should sit and stand with our shoulders back and down and in a kind of military type position. And actually, this couldn't be further from the truth, because in reality, it's the variability of the position that matters more than the position itself. So I don't mind if you're sitting in a bad posture, kind of slumped down, if 10 minutes later you change that position, because it's movement that the body seeks more so. Being in a good posture for long enough is actually going to have a negative impact on you. And so if you are working on a laptop, we want to try and modify that into a desktop. So put that laptop on a couple of books, bring it up to eye level, get yourself an external keyboard and mouse, And so what we want to do is make sure that the elbow isn't reaching too far forwards for these extended periods of time, because that will draw us into a position that if we stay there for too long, then it's going to aggravate the joints and the muscles at the back of the neck. Okay, if I'm there for 5-10 minutes, fine, and then change the position. Go from sitting, go to standing, keep changing that position. And that's the most important thing. But for a specific advice, we want to make sure that the monitor is at eye level. We want to make sure that we're sat back in the chair all the way. And so I want to feel like there's some support pushing me forwards, and I'm not sat on the edge of the chair forcing me to slump down. And we want to make sure that the elbows are tucked in by the side, which generally means bringing yourself in closer and getting the mouse closer towards you. So with the acute painful neck, please do follow the mobility series below. But as we've already said, you need to make sure that you're not moving into the pain. You can also follow the mobility routine within the mid-back section, because that's also going to help take the pressure off the neck. Once you've completed that and the pain starts to settle down, then you can look to the stability and strengthening areas. If you are getting some neurological symptoms, perhaps some tingling in the arms, then you can also look to the section on nerve glides, where we're trying to just stretch some of the nerves in the neck, and this may be more specific to your problem.